Hey guys, it's Miss Reyes and Miss Ratcliffe, and today we're going to be going over your phlebotomy skill.
I'm going to be reading from your skills checkoff sheet, so this should go directly in line with what you have on Blackboard. So the first thing you're going to do is review your physician's order to determine the patient and type of test in which blood is to be drawn. Then you're going to obtain your requisition and compare it to your physician's order. Next, you're going to determine whether special conditions such as fasting or specific times are required and have been met before you draw those labs. We're also going to gather and prepare our equipment. So we're also going to make sure that we have all of our equipment isn't expired, there's no rips or tears or holes in anything, everything looks good. When you're choosing your different blood tubes, you need to make sure you have the correct tubing color based upon the lab, and you have to know what order those are supposed to be drawn in. Now we're going to make sure we verify our patient's identity by checking the patient's identity band and using a second method. We're going to wash our hands. Now you're going to want to assess the patient's vein to determine which type of phlebotomy equipment will be best to use. We've already gathered our supplies. We're going to go ahead and start preparing them. We're going to screw the needle and winged infusion set into the plastic tube holder or syringe. And we're going to make sure that you are very sterile with those connections. We're also going to make sure we have our 4x4 open and have all of our supplies ready. Again, you need to make sure you have the correct type of tubing and the correct way it should be drawn. So we've already verified our patient's identity. We're going to make sure all of our supplies are arranged in the best position before you start to stick your patient. We're going to don gloves. Next, Miss Reyes is going to get the tourniquet and place it 3 to 4 inches above the intended puncture site with the tail of the tourniquet extended from the top side using the quick release method. When you're in the lab using our IV arms, this is sometimes kind of tricky because there's not a lot of weight to the arms, but you always want to use that quick release method. So we're going to palpate the intended vein. Once you have your vein, you're going to clean the site with 70% alcohol, chlorhexidine, or whatever is designated by that facility, and allow that site to dry. Make sure your evacuated tubing system is ready and that you have placed the tube loosely into the plastic tube holder. Now we're going to uncap our needle, maintaining sterility, positioning the needle so that the bevel is up. We're holding the plastic tubing so it rests on the fingertip and thumb of the top of the holder and letting the tube lay loosely on the holder. All right, now Miss Reyes is going to stick at an angle between 15 and 30 degrees, piercing the skin swiftly with a continuous motion, looking for a flash. Move in just a little bit.
I'm going to let go so that you can see the flash that I'm getting.
Okay, so if you look, you can see the flash. We're looking for that to make sure we're in the vein. Once in the vein, brace the hand that is holding the phlebotomy device firmly against the patient's arm, pushing the tube into the needle carefully. Okay, you see how she engaged it, and now her tube is filling. We're stabilizing that needle the entire time. Once she is done, please make sure that the tube fills completely, meaning as much blood that will go into it. It's usually 3/4 the way. Once she is done, she's going to remove that tube, inverting it 2 or 3 times and putting it aside. If you need to draw more labs, you can pick up the next tube and fill it and repeat the process. Once done with all of your tubes, you're going to release the tourniquet before removing the needle. Using a non-dominant hand, place a 2x2 gauze pad over the needle insertion site while removing the needle from the patient's arm, applying firm pressure. Okay, you're gonna withdraw the needle, hold pressure over the site long enough to prevent bleeding, place a piece of gauze with tape over it, and you're also gonna engage your safety device.
This one doesn't have one.
Uh-oh. If you have a safety device, you would engage it and you would immediately dispose of that in the sharps container.
Oh.
So you're gonna dispose your Vacutainer and any non-sharps items in the trash and putting your sharps in your sharps container. We're also going to label each tube according to facility policy. Usually you're gonna put your patient's sticker on there. Make sure that you verified their name and date of birth. We've already done that, but you need to verify that with the tubing and what label you're putting on there. You're also going to add your initials, time, and date. Place the specimen in a plastic bag or specific container along with the requisition. Then we're going to remove gloves and wash hands. Reassess the puncture site to ensure that bleeding has stopped before leaving the room. We're also going to document the procedure in the patient's chart and deliver the specimen to the lab. Please let us know if you have any questions.